Hello everyone, this is Renee McDonald and this is a summary session of the training and information session that I held at ACAP on Saturday the 3rd of November. For those of you who couldn't hear some of what I was saying, I actually thought, and I've done some hard thinking, I didn't want you guys to miss out. So here we go, here's a pre-recorded version of the live event that was in person. Okay, so I'm going to start my sharing of my screen, and this is an introductory session about online practice. A reminder that this is not a thorough training event, and I do provide other thorough training regarding online therapy. However, that involves a lot more time. Okay, so I wish to acknowledge the Aboriginal and Torres Strait Islander people as the traditional custodians of this land in Australia. In my area of the south coast of New South Wales, I acknowledge the Dharawal people of the Wadi Wadi clan as the traditional custodians of the place that I reside here as I'm recording this. I also wish to acknowledge the tribes wherever you reside, and also those people from past and present from where you reside as well. Okay, so I'm Renee McDonald, and thank you for those of you, if you came in person, thank you for your support. Thank you for showing up, and there were a few technical difficulties on the day. People at home couldn't hear me and all sorts of things happened. So in response, this is my recorded video. So I'm a counsellor, coach, spiritual practitioner, educator, and I offer a multitude of different things to the community. I've worked at it for over 16 years. I have a graduate diploma of counselling and master's of applied social science. I also have a certificate for in training and assessment. Worked in education settings for over 12 years. That includes TAFE. I worked at TAFE, worked at ACAP. I've worked at open colleges in the online environment as well. So I've worked in large government training organisations and private enterprise. I've also worked in face-to-face counselling training, both online and in person for the last few years. So for my business, I've been offering face-to-face counselling. I've offered coaching, supervision, all sorts of things for couples, families and individuals. I now have Australian online therapy training as well, which is my training that I offer to people for the online environment. So that's a little bit about me. So welcome to this introductory workshop, and it is the introduction to online therapy. So just a note that this is a pre-recorded session. This is not live, so you can't ask me questions directly. Hence, it's much shorter. I'm going to just whiz through this in order to make sure that this is the best use of your time. Okay, so skip over that. And the learning outcomes. So from this pre-recorded, you'll learn what is online therapy, networking, screen presence, face-to-face and online therapy, encryption, nerves, privacy, and more. I've added a few extra things because there were questions on the day that I wasn't certain that were going to come up. So here we go. This is also my response to those questions. So this workshop isn't technical support or advice on how you should run your online practice. It's not an advanced technical course, and it's not a course on everything to do with online therapy. So this might help you, and these are just some tips and tricks and assistance for you running your online practice. So firstly, what is online therapy? So there's all sorts of remote online therapy, and therapy has been provided in many forms over the years. Companies like Lifeline have existed for over 50 years. Skype has been used alongside practice since the 1990s. Now, why is there a big surge in online therapy? Well, technology is now meeting the gaps, and so this is why a lot of people are fascinated with this area now. So here in this workshop, we're not talking about Skype or over the phone. The Association for Counselling and Therapy Online recommends all therapy and counselling delivered over the internet, needs to be by secure or encrypted links. Skype personal accounts are not encrypted. So technology is getting up to speed, like I said, and we need to be on that for our clients. And also we need to be aware of sensitive data. So private and sensitive data is a really important distinction that we need to consider. Okay, so Talkspace defines online therapy as being mental health counselling delivered over the internet. Some may refer to online therapy as e-therapy, distance therapy, internet therapy, web conferencing therapy, telehealth. So here in this, we're extending online therapy to include all forms of therapy, psychotherapies, therapeutic practice, complementary and alternative health solutions. Online coaching is separate, business coaching and life coaching as well as separate. So it's present in 5 forms. It can be email counselling, chat, video or web-based, audio only, or virtual reality. So often you'll find services and platforms will offer a variety of different services. And it depends on their platform, on what they offer. So a really good example of that is Beyond Blue in Australia. Check a look at their website. They offer online services. However, a lot of these online services don't offer this kind of video conferencing where you can actually see people, though some are, and Men's Line is a really good example. Okay, so we want to gaze towards a positive future where we can utilise the latest technology for the benefit of both our supervisees and our clients, and we don't want to look at that bleak future predictions. So we're kind of looking at the supervisory and also client space that could be paved out in our new digital age. So being digitally ready is essential in our online environment. So whether you choose to provide online therapy is up to you. Though if you are, you need to be able to attract those clients in our globalised world. So we've got social media and the internet. What are you going to do about that? So this workshop and this pre-record is about how to maintain that flexibility in your practice of holding the space for your clients and the additional skills required beyond this workshop for you to provide online therapy. So from my perspective, networking is the secret ingredient to the online therapeutic space. How can clients find you if they don't know where you are offering such services, or if they don't know you're offering online therapy at all? Have you put on your website you offer online therapy? That's an essential part of the equation. Do you have social media accounts? How are people finding out about you? Are you doing blogging? So these are the kinds of things that you need to tap into and you need to consider. Okay, so what I have found, list yourself where you can. There are a lot of free lists that you can be on. Be anywhere and everywhere you can. Do what's possible for you. So start small to end big. You can, like I mentioned on the day, you can list yourself on advertising lists. Some of those examples are Psychology Today, Natural Therapies and Good Therapy. So that's just a few. Be in Facebook groups. There are many therapy Facebook groups. My Facebook groups are called Counsellor Coach Connect channel. That's just a general chit chat between counsellors and coaches and people doing services that might need to connect to others and want some support. The other group is called Online Therapy Connecting and Networking. We really focus on online therapy in that group. So you can connect with people in person and online. I'd recommend that. So relationships exist on social media as well. And generally speaking, it's about kind of texting people and messaging people in the same way you would in person, treating them with that respect that you would in person. Do the same online. It's really essential you make that and bridge that gap between the face-to-face and the online, and then people will feel like it's a person they're dealing with. So that's essential. Okay, so my findings in my work in online therapy, along with my colleagues, is that we all need to work on the following: confidence, competence, and practice. And what I'm going to do with this recording, I'm going to send you the 4 aspects and levels of confidence and competence that leads to further confidence. So apologies. So it's the 4 levels of competence that leads to greater confidence in order for you to practice online. So this is going to be essential that you look into. So in the online therapy environment, it's all about practice, practice, practice. Okay, so encryption is a term that is used in technology and cryptography, which is basically how do people get secure information on the internet. When you make a secure payment with your credit card, how do you know that it's secure? It's basically the process of encoding a message or some kind of information so that only the people who are in the know will get that information. Effectively, it's like having a padlock on your information on the internet. So you can do that, or you can have it more like a safe. So that's something to kind of consider, is how do you want low-level encryption or higher-level encryption? Depends on the clients you're working with. So how is privacy different in the online space, and how is it different? So really, we're looking at encryption is what's different. We can't just put away a paper file if we have a booking app, for example. So it's something to think about. So really, it's recommended in online therapy that we speak to our clients with video conferencing if we can't see them in the same room. Email online therapy can be problematic. So imagine if you're just emailing back and forth with your client, then it really doesn't give you much to go on. Though saying that, some of my colleagues successfully do email counselling. If there are urgent matters to attend to, email therapy would not be recommended. So crisis and severely depressed or suicidal clients, generally email therapy is not recommended for. So what online therapy is not? Online therapy is not, it can't be coaching. So it needs to be professional. There must be boundaries and contracts implemented. So it does not include any kind of coaching or face-to-face work or things that are outside a standard client contract. So the best results I have received from the online environment is with imagining. So I imagine myself in the room with a supervisee or with a client. It doesn't matter which one. We need to then imagine the other person on the other side. And so just if you can close your eyes. So imagine that you've got someone ready to go for online therapy. What we need to then imagine is, if you're about to see this client and she's a person who hasn't been to online therapy before, needs your help, but can only see you for online therapy. She's gone to her doctor, however, she just can't make it to the local psychologist and counsellor, and she knows all the psychologists and counsellors in town. She's decided she needs to do online therapy. How would you start that process, and what do you think you would need to do? So that's just something to imagine. And then we'll just move on to the next slide. So that's just gives you a snapshot of what would I need to do to set up this. So I'll get you to open your eyes again. So my belief is online practice is the way of the future. So we need to be digitally ready and have digital literacy. in order to connect to our clients. So we can't just have our face-to-face practice with and then separate have online therapy practice without them being interconnected. We also need to ensure that, you know, it's about maintaining that flexibility. So whether it's for clients, students, supervisees, it doesn't matter. So whether it's whatever skills and services you're providing, you need to be able to be sure that you feel confident and that you're competent in order to deliver these services. Okay, so what all of this means in a nutshell is that potential clients can book in to see us with a few clicks. So the ideas for booking systems are Setmore, Clinico, HealthKit, Calendly, Acuity, and my payment systems that I've used is Stripe or PayPal. However, I'm now using Stripe pretty much all the time. It can be used at the back end of your website. It can be used at the back end of Setmore in the bookings app that I use. So any of those booking systems, but if you've got a larger clinic, Clinico would be the go. There's another one called Power Diary I haven't mentioned here. That's another one if you're running a private practice. HealthKit, obviously, it's okay, but I find it's good for medical or mental health-based clinicians. So it all depends on what professional look you want to come across to your clients. So that's something to consider. So online practice for therapists and educators and just people in general online, it can be so many things. So it can be online therapy, online education, online clinical supervision, and online coaching. So it involves our interactions on social media, our electronic records, paper records. So we need to consider privacy in all the Facebook groups or social media groups you're on. So we need to be able to kind of make sure we're providing ethical services all the way along. So along with being able to connect with people across a variety of different mediums, we need to be mindful of client privacy and ensuring safety for all. So no matter what kind of private practice, business or organisation you're running, if you have a social media profile, you are working online. So we all know stories of Twitter users fired, for example. So we need to consider how we're using social media. Could it come back to you? How could this affect you in private practice? So for it to be online therapy, like we said before, it needs to be either email counselling or psychotherapy, instant chat, video conferencing, audio or virtual reality. Online therapy in Australia, like we said before, is e-therapy, digital therapy, web conferencing, video conferencing or telehealth. So with any online work, we can virtually meet with our clients online. Technology has now advanced itself so much. You can see me while I'm recording this. And it can be the next best thing to meeting in person. And research from iTherapy, there's a group called iTherapy, they've done some research that actually has proved it's sometimes even better for the clients who can't get out of the house, for the clients who struggle with time, for the clients who just want the convenience. And everyone really is busy these days, so it really is able to slot into your life. You don't have to allow travel time. So these are the things to consider. We can connect to clients that we wouldn't ordinarily. Online supervision and online counselling can be provided through those different services like mentioned. In recent years, we've seen the potential for our client practice to expand. So I can support remote clients, and I've done that, who live far away. Some therapists and health professionals can be supervised or be the supervisor practitioners across the world. I have had international supervision. So this is the things to think about. This is kind of why I'm mentioning supervision throughout this too. So you can meet individual or group sessions, and you can run individual or group sessions online. So it's about the systems that you use that determines whether or not you can actually run all these different online services that actually are possible. So, online video conferencing. Encryption is now essential with online privacy laws. So that we can attend to the Office of the Australian Information Commission. This is what I mentioned on the day on the 3rd of November. There's data breach provisions that we need to be aware of. Australia has brought in new laws related to data breach. The GDPR is the General Data Protection Regulation, that's in Europe. And the HIPAA is the Health Insurance Portability and Accountability Act. Those are two pieces of legislation you need to be aware of if you're working with overseas clients. So we need to be aware of these laws too. Okay, so contracting is essential to the online environment. If there is no meeting in person, then there needs to be another way of clients, supervisees, or students to take responsibility for the work that we're going to do together. I've found that the formalised contracting is essential to individual client work, as well as online supervision, online coaching services, but even more so in online group supervision. Okay, so presence. Ultimately, I speak of presence and holding, and this is the process of online therapy. We've got all the tasks, but what is the process of online therapy? So Kate Dunn and Geldard, let's go back to that. The joining, and Rogers himself, he discusses that need for congruence and genuineness in therapy, and the same applies to online therapy. You need to get better at being on the screen. If you're an online therapist, you need to get better at it. Practice, practice, practice. So the joining space in the online environment, whether it's with a client or a supervisee, is whenever we are not physically present with them. So the state of presence is the state of existing or occurring or being present in the present moment, or it can be a personal thing that exists in present place but is not seen. So it can also be a group of people stationed in a particular place. So presence online is merely just showing up. We can't just show up for our clients in the online environment. We need to make sure we are technically ready. We need to make sure that we are therapeutically ready. So all the client has to go on is this space here. So we need to have our presentation skills of utmost importance in the online environment. So Kate Dunn has completed research into online therapeutic space screen presence. Her argument is screen presence is essential to the online therapy space due to the lack of connection. And this, even in my practice, I've found increases the somatic awareness of the therapist and the somatic awareness of the client if we are physically aware of our presence to the other. And so it's essential we consider our screen presence. So this means you need to practice. You need to practice holding the space. You need to practice with your own nerves in front of the screen and on the screen here. So the Association for Counselling and Therapy recommends attending online therapy specific course, and the Association for Counselling and Therapy online, their members must have attended an online therapy specific course. So that's interesting too. So presence, essence, and the space between is still required for supervision, but it's also still required for client work too. So with our work with our clients online, we need to consider our approach. We need to consider how we appear. So how do we appear here? How is my space in the background? We need to be working with our very essence in time and space between ourselves and the other. And I talk to that in my more advanced training in more detail. So be mindful of the parallel process of our online anxiety. So this is essential too. So your own anxiety can parallel the client and your anxiety. So to become confident in providing online services has been, for me, I've found a trial and error process, but it's making sure that you provide the best possible practice to the client. So I've found mindfulness as well as being in the flow is what works best. Working with our supervisees and clients in the online space, I've found has been that the client actually needs to be ready. And that if, even you guys, if you're working and, if I was supervising you, I would want you to be ready online for your clients. So it's about being confident and competent. Again, going back to that. So delivering these online services is all part of this process to ensure that good practice. And so we limit the counter-transference that can transpire even in the digital ether between me and you right now listening in. Okay, so Skype is not HIPAA or GDPR compliant, and that's really essential to know this. The GDPR is the General Data Protection Regulations, and they apply in UK and Europe, and the HIPAA is the gold standard, but it doesn't exist in Australia. It's US legislation. So it only applies if you're seeing clients in the US. I would err on the side of caution of that, because generally speaking, insurance in Australia does not cover you for working in the US and Canada. So other products of note, so platforms. Dr. Julian's a really professional platform, for example, to have a look at. True Counselor's one, iTherapy is another one, but it's only in North America. You can use things like GoToMeeting. They have encrypted links as well. Obviously Zoom. You've got Zoom or Doxamy or VC, ones that I'd recommend. There's Supportive, which is the Australian Counselling Association's online therapy platform. They also provide clinical supervision on that platform, but you have to be an ACA member. So international sites like eCounselling Essential and Talkspace. There's hundreds of online therapy and online platforms now that assist therapists to get online. So this is where it starts becoming a little bit fraught. What I'd recommend is going with something that you know works. Okay, so products to avoid: WhatsApp, Viber, Nimble, Facebook. So Facebook can do video conferencing now. However, it's not encrypted, so best not to use that, and it doesn't cover any of the privacy laws. And with the Cambridge Analytica scandal, you want to avoid that. So you want to also not have any of your clients as contacts on your phone. How I get around that is using my Set More system. So you can do that with some of the systems that actually exist. So you want to make sure that you are never going too far with, breaching privacy of your clients. So you need to take all your conversations off social media to more private space. Okay, so what this session has focused on. This session has focused largely on the tasks of online therapy. We must not forget about the process of online therapy in order to connect properly to our clients. All of my in-depth courses cover both the tasks and the processes required to be in place for online therapy to be successful with clients in order to create human-to-human connection in this digital space. So if you have any questions, please email me, butterflycourage@gmail.com. And just thought I'd let you guys all know, I have 4 levels of training I can offer you. Level 1 is Fundamentals in Online Therapy. It's where you actually become assessed and accredited as an online therapist. Level 1A is Online Education. That's learning how to structure online learning and implement for your business on the internet. So it's, if you want to run an online course, well, you could talk to me about how you might do that. Level 2, Advanced Online Therapy. If you feel like you've already started your online therapy practice and you don't need some of the basics, You might want to skip to the advanced course. However, if you want to skip to it, you need to be assessed at a level 1 before I accept you into RPL on level 2. So the missing link is somatics, which was actually discussed on the day on the 3rd of November. This is actually discussed in my advanced online therapy training. So level 2A, online supervision. Learn how to do online supervision in the online environment and learn how that's different. What do you need to know on the world stage when practicing supervision online? How do you run online supervision groups? That's what we cover. So we cover individual and online supervision groups, and we cover all the essentials in the international space of online supervision too. So there we go. That's it for today, and thank you for listening. And if you have any questions, don't forget to email me. Thank you for listening through to this, and this has been a really quick summary of what I talked about on the day. Don't hesitate to ask me any further questions. I look forward to hearing from you. Again, send me an email, butterflycourage@gmail.com, and all the best with your online practice. Bye for now.